Who should avoid cystoscopy for bladder health reasons? Have you ever wondered who should steer clear of cystoscopy for bladder health? Cystoscopy is a common procedure that allows doctors to look inside the bladder and urethra using a thin tube with a camera. While it is generally safe and useful for diagnosing bladder conditions, there are specific groups of people who should avoid it due to potential risks. First on the list are individuals with an active urinary tract infection. If someone is experiencing this type of infection, it is best to wait until it has been treated. Doing cystoscopy during an infection can worsen symptoms or even spread the infection, leading to more serious issues like sepsis. It is crucial to ensure the infection is resolved before proceeding with the procedure. Next, those with severe urethral stricture or obstruction should also avoid cystoscopy. A significant narrowing or blockage of the urethra can increase the risk of injury during the procedure. In these cases, doctors might consider alternative imaging methods to prevent any trauma to the urethra and bladder. Patients who have had recent bladder or urethral surgery should also delay cystoscopy. Healing is essential after surgery, and performing the procedure too soon can disrupt healing tissues and increase the risk of bleeding or infection. People with severe bleeding disorders or those on blood-thinning medications need to be cautious as well. They may face a higher risk of bleeding during or after cystoscopy. It is important to assess their condition carefully and possibly adjust medications before the procedure. Sometimes, cystoscopy may need to be postponed or done with extra precautions. Additionally, individuals who experience severe pain or anxiety that cannot be managed with sedation should reconsider. While local anesthesia or sedation is often used, some patients may find the procedure difficult to tolerate. In such cases, doctors might explore alternative diagnostic options or enhanced sedation methods. Lastly, pregnant women should approach cystoscopy with caution. While it is not strictly contraindicated during pregnancy, it is generally avoided unless absolutely necessary due to potential risks of infection or trauma. If cystoscopy is needed, it should be performed with extra care. In summary, cystoscopy is a valuable tool for diagnosing bladder health issues, but certain conditions warrant caution. Active urinary infections, severe urethral strictures, recent surgeries, bleeding disorders, unmanageable pain or anxiety, and pregnancy are all factors that may require avoiding or delaying the procedure. Always consult with a healthcare professional to discuss any existing health issues or concerns before considering cystoscopy. This ensures that the safest and most effective care is provided based on individual health status.